You kept going when it would have been easier to stop. That took courage.
Your roommate has been diagnosed with tuberculosis. You are identified as a priority A close contact. At this point, you are immediately evaluated with IGRA, symptom screening, and a chest X-ray. Explain the purpose of each test based on the diagnostic approach to tuberculosis. In the evaluation of a close contact, tuberculosis is assessed by separating infection from disease. Even if a person is infected, symptoms do not necessarily develop. Does each test indicate infection, or does it indicate active disease? When Mycobacterium tuberculosis enters the body, macrophages first ingest the bacteria and present its antigens to T cells, essentially saying, this bacterium has these antigens. If the person has been infected with TB in the past, TB-specific memory T cells recognize the antigen and respond by saying, that's tuberculosis. It's an enemy. And they release interferon-gamma. The released interferon-gamma activates macrophages, enabling them to attack Mycobacterium tuberculosis more effectively. What IGRA measures is this interferon-gamma released by TB-specific memory T cells. In individuals who have been infected with TB, TB-specific memory T cells are present in the blood, so stimulation with TB-specific antigens triggers interferon-gamma release. In contrast, if a person has never been infected with TB, these memory T cells do not exist, and interferon-gamma is not released. However, it is important to note that after TB infection, it takes approximately 8 to 10 weeks for T cells to differentiate into TB-specific memory T cells. Therefore, to accurately determine whether TB infection has occurred, IGRA must be performed 8 to 10 weeks after exposure. IGRA does not detect TB itself, it detects whether the immune system remembers TB. Next, let's clarify what developing disease actually means. To develop disease means this: a pathogen is replicating inside the body, causing tissue damage, and that damage becomes clinically visible as symptoms, physical findings, or imaging abnormalities. In USMLE thinking, you only need one of the following three to say that a patient has developed disease. First, symptoms. If the patient has symptoms, that alone is enough. Symptoms equals disease. Second, objective findings. Even if the patient feels fine, if imaging or exams show objective organ damage or abnormal findings, the disease is already there. No symptoms, but abnormal findings equals disease. Third, microbiologic evidence. Even if symptoms are mild, if testing proves that the pathogen is actively present and replicating, that still counts as disease. Active pathogen equals disease. Disease is infection you can see. Thanks for watching until the end. Today, we reviewed how IGRA works and clarified the key difference between TB infection and TB disease. Do you understand the mechanism behind the TST?
For quick, powerful reviews, this is the only channel. Don't forget to subscribe.